there are about 1.5 million Americans who get their insurance through something called a health care sharing ministry. And if you don't know what that is, I will tell you in a second, but they're very disturbing. They lead to all kinds of horror stories. And there was an article recently from NBC News that looked at one of these specifically, and it's a reminder that these ministries need to be regulated and held accountable before people get screwed over. And let me try to explain to you what these healthcare sharing ministries are. What they do in most cases is they ask everyone in the system to pay a certain amount into the insurance pool every month, which is that's how insurance works. But the companies don't necessarily collect all the money or send it to healthcare providers. Some of these companies work because for a fee, they just tell you where to send your money. Like, hey, Bob in Nebraska had surgery, so he needs this much money. We need you to send a check for X amount of dollars to Bob in Nebraska. Or some of them might just reimburse those members themselves. If you need something covered, you have to tell them you need it covered, and theoretically, they will reimburse you. Now, that is not all that different from regular insurance. But the difference is this is not regulated, and not all services are covered. And the providers can cut you off at any time if you become too expensive to insure. And if you do something that they think is immoral, you won't get any support at all. That means no contraception. You're not allowed to get support for that. No coverage if you have a same-sex partner. You definitely are not going to get any care for abortions. So, like, everything is fine until the very moment you actually need them the most. And then who knows, they might cut you off, right? That's why these healthcare sharing ministries are so disturbing. So there have been so many stories written about these over the years where customers are like, I was denied help exactly when I thought I needed it. And in a lot of these ministries are like gambling. You don't know what you're going to get. It is just organized theft of a sort, except people don't realize they're gambling with their lives. And for years now, and I've talked about this in other videos, different states have taken action against these ministries. They have sued them. They have argued that they are denying too many claims. In California, the attorney general said that one healthcare sharing ministry spent only 16 cents out of every dollar in premiums on healthcare expenses. And by contrast, the Affordable Care Act requires insurance providers to spend at least 80 cents of every dollar on expenses, right? So it's just horrible. There have been Democrats in Congress who have tried to crack down on these companies. Last year, Jared Huffman, the congressman from California and the co-founder of the Congressional Free Thought Caucus, he actually filed a bill called the Health Share Transparency Act, which would have just given consumers more information about these organizations. It didn't go anywhere because Republicans control the House, but there you go. So the reason I bring all this up, and I'm kind of jumping down here for the sake of time, is that this story appeared on NBC News recently. And you could see, look at this headline: faith-based cost sharing seemed like an alternative to health insurance until the childbirth bills arrived. And this whole story is about these Christian families, very devout Christian families, who decided we don't want to get Obamacare. We don't want to get regular insurance. We want a faith-based company to work with. And the story, the headline story there, is about a woman named Rachel Kaplan. And she said she became pregnant in 2023. She knew she needed insurance, and she was told to speak to a company called Sedera, Sedera. But after her son was born and the bills were due, and we're talking about $7,000 here, Sedera told her, yeah, we're not covering any of this. To the couple's shock, they said, Sedera told them they were ineligible, citing a policy near the end of the group's member guidelines. Within the first year of membership, medical bills for childbirth are not shareable. We basically gave Sedera our money and received nothing in return, Kaplan said. The rug was pulled out from underneath us. And Sedera did not respond to multiple requests for comment. Like, that's horrible. And listen, I already know healthcare is horrible. America's healthcare situation is awful. Every other civilized country in the world makes fun of us for exactly that reason. And we totally deserve it. But do you know how bad you have to be part of the American healthcare system and be like at the bottom of the pile when it comes to how bad you are? Like, that's like failing a class full of failures. Like, it's uniquely awful. And when NBC News spoke with several couples, they said similar stories. They said they were denied or they struggled to get reimbursed by their healthcare sharing ministry for pregnancy or childbirth. And they're finding out that this faith-based model can be just as bad, if not worse, than the systems they opted out of. And it's true, like, healthcare sharing ministries can deny you for pre-existing conditions. They might not cover mental health issues. They might not cap out-of-pocket costs. And again, there is a chance that even if you're supposed to be covered for something, they may not have the money to cover what they promised, even though the law requires legitimate insurance companies to maintain enough money for things like that. Like, it really is a form of gambling. This is another thing to point out here about all this. Why are they so popular when they suck this badly? And this is what one company said in the piece. Some experts and state regulators say many healthcare sharing ministries promise more than they deliver or take advantage of people seeking affordable coverage, in some cases giving consumers the false impression that they are entitled to reimbursements or are purchasing insurance plans. The way they are marketed and designed, many people buy them thinking they're insurance and not realizing what the differences are. So, like, well-intentioned people think, like, I need insurance, let me go to this Christian ministry, and they don't realize they're not really getting insurance. They're getting an off-brand, shittier version of it, right? And it's awful. This is not about one anecdote, though. This isn't about one family, because if that's all this was, you could find examples of that for any type of insurance company. This is commonplace for healthcare sharing ministry members. Another woman cited in this article said she got unexpectedly pregnant and needed insurance, but Christian healthcare ministries told her, sorry, you needed to sign up 300 days before your due date if you want us to reimburse you. And that's 10 months before you're pregnant. Or I'm sorry, 10 months before you give birth. In other words, you have to sign up for insurance before you know you're pregnant if you want us to help you with your pregnancy. And honestly, on some level, I actually think that makes sense. You don't want people joining an insurance program for a specific benefit and then bailing afterwards. Like, that would destroy whatever system is here. But that is an argument for why we need universal health care and why this couple should have had regular insurance to begin with, not just a justification for why that particular ministry's call was appropriate. Of all the problems this article goes into about these healthcare sharing ministries, denying a couple coverage for not coming in on time, that is actually low on the list, because I think that could be reasonable. A better example would be that a couple had coverage, had a baby, and then got rejected for reimbursement for other reasons. And guess what? That story also exists. There was a couple, the guy's name is Warren Walborn. This is what he told NBC News here. Walborn said he was never reimbursed for his wife's prenatal care or the delivery of their daughter, Sophie, in 2021. He said he submitted invoices within 180 days per the policy, but the company then needed itemized charges and more documentation. The back and forth continued long after 180 days, at which point Liberty told him he just is no longer eligible for reimbursement because of the time limit. I kept fastidious records of all these codes and everything. It was never good enough for them, he said. It was like, if I had hair, I would pull it all out. I said to myself, why am I sending them money every month? They're never going to send me anything, which is true and awful. And I feel bad for that guy. But also, yeah, that's what you signed up for. You signed up for a fake insurance company and now you're mad they're not giving you insurance. Like, it's unbelievable. Conservative Christians spend so much time encouraging couples to get pregnant early and often, and yet Christian healthcare sharing ministries actively make it harder for these families to have babies at all. Meanwhile, if these families had a regular insurance provider, say through Obamacare, they might actually do all these things their religious leaders tell them to do. So, what is the upside to any of these groups? Like, the monthly premiums are lower, and the group's stated values might align with your personal beliefs. But things are really bad when regular insurance providers look good compared to these groups. And I just want to point out to you that Donald Trump's pick to head up the Centers for Disease Control and Prevention starting next year is a guy named Dave Weldon. And that guy is the former president of the Alliance of Healthcare Sharing Ministries, which is a trade group representing several of these fake insurance groups. Earlier this year, that alliance sued the state of Colorado because Colorado said, we want you to give us operating, statistical, and financial information so we can perform some basic accountability with all insurance companies to make sure you're doing the thing you say you do. And this group is like, well, that violates our religious freedom. Unbelievable. So that's the guy Donald Trump chose to run chose to run the CDC. That is frightening. Man, the fear is that this dude is going to steer even more Americans into these scams, which is a thing Donald Trump loves. One last thing I wanted to show you is that in this NBC News article, there is a picture of Donald Trump hugging an American flag, which I'm sure you have seen because people make fun of it all the time. But check this out. I had not noticed this when I've seen this picture before. There's Trump hugging the flag, but look at the sponsors at the CPAC event he's at in 2019. Look at the bottom. Liberty Health Share. Like, these groups are supporting these healthcare sharing ministries, are promoting these conservative conventions and causes, and now they're going to be rewarded for it, which means Americans are going to be screwed over. All right, I'm going to stop there for now. Hopefully we could fix up some of this lag here. But what questions do we have? Thank you for that donation, Olivia. What they don't realize about the KJV is that it's a very pro-monarchy one. Talking about the last story about KJV Bibles. And again, I think they like I think they like the idea of a monarchy and a dictator and a king. It all sounds great to them, so they're not bothered by it one iota. What else we got here? Oops. Oh, there we go. Lack of affordable childcare has literally prevented us from having a kid. I'm so sorry to hear that. But you're right. Like, this again goes down to, we need universal health care. We need to support families that have babies. They do it in other countries for less money. Why can't we do it? It's because too many. You have the entire Republican Party and you have plenty of Democrats who are beholden to lobbying money. They want to prop up a bad system rather than fix the problems. So yeah, I'm sorry you're dealing with that, but sadly that you're not alone. F insurance altogether. Whoops, where did that go? I'm trying to pull this up. There we go. F insurance altogether. We need and deserve universal health care. If Donald Trump successfully invades Canada like he claims he's going to, maybe Canada can just take us over and we can get their health care. How much better off would we be? I thought one needed a letter from your minister that you were a member in good standing to get that health share insurance. I believe you're right. I believe some of those ministries do have that requirement that like your pastor has to approve you for it. But even if you have that, it doesn't mean that company is going to be legit. Other questions here. Well, if the politicians and super rich weren't working hand in hand to destroy our economy and rig systems to their benefit, we could have good healthcare. Right there with you. And again, I want to blame Republicans and they deserve the blame, but it's not just them either. Healthcare should be human rights. Agreed. Absolutely agree. It should be. Every other country's figured it out. That woman is lucky her childcare bill was only 7,000. Can you imagine if her baby needed to be in the NICU or if she had complications? I mean, yeah, that was a normal pregnancy where nothing disastrous happened and it cost that much money. And people from other countries are seeing that and thinking that sounds insane. It's free to have babies in our normal country. Yeah, but our healthcare system sucks. Again, I've been through it a couple times myself. Like, hate dealing with insurance, hate paying my premiums, which are insane. But also, the alternative could be so much worse. Do these healthcare ministries have any sort of comprehensive mental health care providers in their coverage parameters? My guess is not. I think it depends on which one we are talking about. But in general, I mean, these are the same people who think mental health disease is not a real thing because it's probably just Satan. So, pray about it, get some Jesus in you, and then it'll just go away. So they're not going to cover a thing they don't even think is real. You think they're going to cover LGBTQ concerns specifically? Of course they're not, because they don't think that should be fixed in the way it should be. Worse, how? Man, you could be talking about anything right there. I don't even know what we're talking about anymore. You got to narrow it down. Everything's horrible. Do these help? It's not about babies, it's about controlling women. Absolutely true with a lot of these. But you would think if they want to control women, they would want to make them have more babies. And there are better ways to do it than forcing them to like not have good insurance. The Kochs bought Clinton and I assume you mean DNC, hence no opposition. Again, there are plenty of Democrats who rail against the system and they don't take money from those people. But you're right. Like plenty of powerful Democrats are in this too. They are not blameless. So I'm not arguing with you on that one.